Hi, I'm Dr. Snow, your integrative pharmacist. Welcome to Healthy Truth Consulting. Do you have or know of anyone who has Polycystic Ovarian Syndrome? If so, today's topic will help shed some light on this scary but manageable diagnosis. Polycystic Ovarian Syndrome, or PCOS, is a metabolic disorder that affects up to 20% of all women. However, only about 10% are diagnosed. PCOS is the #1 cause of infertility in women and can increase the risk of type 2 diabetes, cardiovascular disease, and endometrial cancer. Treatment of PCOS is by diet and hormone therapy. Symptoms of PCOS include acne, hirsutism, or excessive hair on the face, chest, and back, insulin resistance, weight gain, erratic or absent menses, and infertility due to not ovulating. Diagnosis of PCOS is not well defined, but is made via ultrasound of the ovaries showing multiple cysts or by blood tests showing hyperandrogenism or high testosterone levels. While the cause of PCOS is unknown, there may be a genetic link, and it can be inherited via either your mother or your father. One study showed that 24% of women with PCOS had a mother that also had the condition. Your doctor may choose to put you on birth control tablets, also known as the pill, to help regulate your menstrual cycle by correcting the estrogen-testosterone imbalances. Benefits of the pill include lighter, more regular menses about every 28 days. Menstrual cramping may also be less intense. Excessive unwanted hair on the face, chest, and back may decrease, but this may take 6 months or more to be seen. Also, the severity of acne may improve. Unwanted side effects may include nausea and/or vomiting, especially when first starting the pill. This may be decreased if you take it with supper or right before bedtime, and often goes away after a few days or up to a few weeks of being on the medication. Women prone to migraines may experience an increase in frequency and intensity of these headaches. Other women report mood changes while taking the pill, including being irritable and weepy. If increased headaches or moodiness happen to you, discuss other treatment options with your physician. Breast tenderness and swelling may occur in women on the pill. This is a fairly common side effect and may be relieved by cutting back on caffeine and salt and by wearing a good supportive bra. Tenderness usually goes away after a few months, but if it doesn't, or if you find a lump, see your physician immediately. Another side effect of the pill is weight gain, but this is infrequent in the formulations available today and is usually due to fluid retention. As with most occurrences of water retention, drinking more water will help keep the kidneys flushed and able to remove excess water. Birth control tablets can increase the risk of blood clots in susceptible women. The risk of a clot is increased in women who smoke, have high blood pressure, heart disease, diabetes, or those who have a personal or family history of clots. Before starting birth control tablets, make sure your physician is aware of any of these risk factors you may have so that the two of you can make an informed decision about the wisdom of starting the pill. Treatment of PCOS should also include weight loss if you are overweight. A 10% loss of weight may be enough to decrease the hormonal imbalances and restart ovulation. Regular exercise is important. Brisk walking for 20 to 30 minutes, 3 to 5 days a week can help decrease weight and increase insulin sensitivity. You should eat a low glycemic index diet and avoid refined carbohydrates. Moderate amounts of complex carbohydrates is recommended to maintain blood sugar levels. Avoid white foods such as bread, pasta, white rice, white potatoes, and sugar, which can cause blood sugar spikes, followed by the release of insulin, which leads to rapid lowering of blood sugar. Avoiding high glycemic index foods can help stabilize this up and down roller coaster of the blood sugar. Eat lots of fresh vegetables and 1 or 2 servings of fresh fruits each day. but you should avoid fruit juices as they contain a high concentration of sugar. Eat plenty of good protein and good fats such as avocado, coconut oil, and olive oil. Drink caffeine in moderation and avoid sodas completely. One regular 12-ounce can of soda contains about 33 grams of sugar. That's over 8 teaspoonsful of empty calories. And diet soda should be avoided also, but that's a whole nother post. Drink filtered water. It's good for you. Taking a good multiple vitamin will supplement most dietary deficiencies. Choose a vitamin mineral product that contains quality, absorbable constituents, preferably a liquid that is easier to absorb than tablets. Vitamin D deficiency has been shown to be common in women with PCOS. Having your vitamin D level checked to determine if a supplement is needed may be beneficial. Most people need 600 to 1,000 international units daily. Vitamin D may decrease insulin resistance and help regulate menstrual cycles. Other supplements that may increase insulin sensitivity include alpha-lipoic acid, which has been shown to decrease blood pressure and insulin resistance, and reduce triglycerides, all of which may decrease the risk of cardiovascular disease. The recommended dose is 600 milligrams twice each day. Magnesium has been shown to be low in the general population, not just in PCOS patients. Magnesium helps insulin move glucose into the cells and is considered a critical mineral for women with PCOS. 500 to 1,000 milligrams of magnesium daily in a well-absorbed form such as magnesium citrate is recommended. Since magnesium also acts as a laxative, you may need to adjust the dose to your tolerance. L-carnitine is an amino acid that helps the body turn fat into energy, helps metabolize glucose, and is an antioxidant. Women with PCOS have been shown to have up to 50% less L-carnitine than women who do not have PCOS. The recommended dose of L-carnitine is 500 to 1,000 milligrams daily. Cinnamon has been studied for over 10 years and has been shown to lower fasting blood sugar, triglycerides, and LDL, the bad form of cholesterol, and total cholesterol. Doses studied range from 1 to 6 grams per day. Coenzyme Q10 is an important cofactor in many metabolic pathways, especially in the production of energy. CoQ10 has been associated with reduced blood pressure and cholesterol and may boost energy and enhance the immune system. The recommended dose is 100 to 200 milligrams daily. Just 1 tablespoonful twice daily of aloe vera juice has been shown to decrease blood glucose levels. And 1 cup of green tea daily has been shown to lower blood glucose levels by increasing insulin sensitivity, and it may also increase the body's metabolic rate. It is also a good antioxidant. America is sleep deprived, and it affects nearly every aspect of our lives. Women with PCOS and everyone else should be getting 7 to 9 hours of sleep each night. Sleep not only heals our mind, but also heals our body. Sleep deprivation has been shown to increase insulin resistance and therefore increases the risk of diabetes. It may also cause weight gain due to hormone imbalances and has been linked to decreased fertility. Sleep deprivation also increases the risk of cardiovascular disease and stroke, hypertension, ulcers, and some cancers. It is important to get some sleep. Finally, take a deep breath. PCOS can be managed. So most importantly, choose a qualified health professional to help you make informed choices about managing your complete health. An integrative health professional can help you make choices about which medications and supplements are best for you. Thank you so much for joining me today. What are your experiences with Polycystic Ovarian Syndrome? Please add your comments and questions below. I'd love to hear from you. Remember, only you can manage your health. Have a blessed day.